Hey everyone, it's Dr. Morales, returning back at you again this week for frequently asked questions that I get about plastic surgery. The topic of the week is a great one. It's related to breast augmentation, and it is, the question is, 7 questions you should ask your surgeon about breast augmentation before the procedure. So I kind of picked out the top 7 that I was talking about with Linda, and kind of run through them. I'm gonna kind of tell you what you should ask your surgeon, and then I'll kind of give you my feedback on how I would answer that. So the first one is how many breast surgeries do you perform per year? Me personally, I'm right around the 200. I did 195 breast augmentations last year. Some surgeons do more. I don't know. I'm just telling you what mine is. I think I do a lot. It's one of my favorite procedures to do is breast augmentation with implants, and I feel like I'm very fluent. I get consistent results that are safe. So that's my answer. The second is, what type of implants do you recommend? I would say, for my answer for that, is that most patients are using a silicone product. That I would say that's across the board in the United States, if not the world. There are choices between saline and silicone. The silicone products now, we're on our 5th generation of gels. And these implants are engineered for safety and for softness, performance, shape, desires, all of it. So the catalog of silicone products we have now for kind of a look that the patients want is quite extensive. These implants come in different sizes, profiles. It really depends on your anatomy and what your desire to get out the breast augmentation. But I would say in my hands, I would say 98% of the time silicone product is used. Question 3 is, how many patients of yours experience complications? Great question. So, surgery is not free of complications. Every surgeon will have a complication at some point. It's just the nature of surgery. Things can happen. For breast augmentation specifically, the most common ones are going to be infection, bleeding. The next one is called the scar formation. It's called capsular contracture. And what that happens is that there's a scar bag that forms around the implant, and that for some reason that space is irritated, and so the body reacts by forming a thick scar. And when that happens, it can distort the shape of the breast. It can get firmer. It can look a little bit different. That's called capsular contracture. So I've had 2 hematomas on 2 sides. My patients, probably in my past 8 years, I only had 2. And I'm averaging somewhere around between 150, 200 breast augmentations per year. Infections, I've had 1. That was several years ago. And it's kind of an interesting infection for me because she was like 2 months out from surgery, and then she had some sinus surgery, and they rotated her sinuses out. And within a day or 2, for some reason, it basically seeded her implants, and then she had an infection, had to take them out, and then we had to redo her augmentation 6 months later. That's kind of a weird one. It wasn't right after surgery, but it's an infection that I experienced. And the next one is capsular contracture, and capsular contracture is probably the most common complication associated with breast augmentation. If you read the literature and you look at the studies across the world, it's going to average anywhere between 10 and 20% of the time. It's a known issue. It comes, how do patients get it? It's typically associated to, some kind of irritation around the implant the body doesn't like. It could be an infection, it could be bleeding. Subclinical infection is probably the most common cause that we think that happen. That's why it caused. And it's just skin contamination. So the skin that has microbacteria on it, and then what happens is, the implant's placed through the skin, and then for some reason, little bacteria gets in just enough to piss off the body, and you have this phenomenon called scar contracture. For me, I have probably 2 implants per year. Last year in 2020, I had 2. So it is what it is. I do the best I can to avoid it. That phenomenon is, if that happens, different vendors through the United States will have warranties for that specific complication. It's called capsular contracture warranty. The implant vendor I use is called Sientra, and they have a specific warranty associated with that. So my patients, for me, are taken care of if that happens. So next question is related to pain, and the question is, how long will I be in pain after surgery? In my hands, my patients are on pain medications, which is typically a narcotic, anywhere between 3 and 5 days. I do have more of a fast recovery option, which requires a medication that we use called Exparel. And it's a long-term local anesthetic, and I basically inject it into areas of the chest. It's kind of performed in a block technique, and that dramatically decreases the amount of pain patients experience after surgery. It does cost a little bit more, but on average, my patients who have breast augmentation just on narcotics average between 3 and 5 days. Most of the patients are back to work in a week. You're driving, it's just a little tight pressure sensation, but it's very well controlled. Question 5 is, should I worry about infection? And I would say if you're in the United States and you're with a board certified plastic surgeon who's in a accredited facility, the risk of infection is very, 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 very low. As long as they're very careful with their instruments and their surgical technique, and just reducing all possible chance of infection, the infection rate it should be extremely low. For me personally, I take every precaution. All of our equipment in our facility is obviously processed and is sterile. The skin is basically cleaned with a surgical prep for surgery. I put nipple shields on the nipples to reduce skin contamination from the breast tissue itself. Once I create the space is irrigated with antibiotic irrigation. I also use betadine. I use a funnel sleeve. It's called a Keller funnel, and it's called a no-touch technique, so it minimizes the amount of times you touch the implant. The implant sees air for very, very, very minimal amount of time. It's opened, I put in the funnel, it's washed with minute, and I don't know if you've ever seen me do it, but it goes in real quick, and then I close a hole. It's that quick. So I do everything I can to reduce infection. IV antibiotics are given throughout the surgery. After surgery, I do a course of antibiotics as well to further reduce it. So I feel like I do everything I can to reduce that risk. Question 6 is, how long will my recovery be? For breast augmentation and also breast augmentation with breast lift, I pride myself in having my patients get back into more normal life activities as quickly as possible. Exercising for me is part of my lifestyle, and I work with a lot of my patients who also have those similar desires to work out quickly. My patients are instructed on the resumption of exercising. At the first week, we talk about it, we start mentioning it, but we then resume training and exercising week 3. We talk about cardio, we talk about weight training and other modalities of exercising. I think most of my patients are very surprised like how much they can do, but there are some restrictions. So, that's me personally. If you've had surgery with another surgeon or considered surgery with another surgeon, don't listen to me. Listen to your surgeon. I don't want to get a call from your surgeon and say, well, you told them. No, I didn't. No, I didn't. My patients get it from me personally. You hear it at your week 3. So that's the way I do it. All right. Next question is, will my breasts look natural? So define natural. So augmentation by definition is not a natural thing. There's a look that patients will desire. Some patients will look very natural appearing. So what is natural? Is it something that your family will notice? Is it something that your friends will notice? Is it something that people that you don't even know will notice? It's all relative to what you want out of it. So I encourage my patients to find something what you want out of it and what you makes feel look good. Feel more confident about yourself. I'm just a technician. I'm here to kind of guide you and make those decisions. This is not my decision. This is your decision. And we talk a lot about it before your procedure. So that is kind of the nuts and bolts. I think those are great questions to ask a surgeon if you're going to have a consultation for breast augmentation. I think these are some great questions. So thanks again for following. I appreciate your time as always, and I'll see you next week.